My name is Dr. Marlin McKay. I'm a general practitioner in private practice, and I'm based in the suburb of Florida, which is part of Roodepoort, here on the west rand of Johannesburg. The word that's on everybody's lips, and that is COVID-19, the pandemic, coronavirus, SARS-CoV-2, call it what you will. It's affected all of us. And it's amazing. We used to say, HIV, there are only two types of people. You either have to be infected or affected, and you don't have to be infected to be affected. And now it seems to be that we're saying the same thing about COVID-19 and SARS-CoV-2. You don't have to be infected. We are all affected. And I think soon we are all going to be infected. And this is where the spike is coming in, and this is where the tremendous rise in infections. I was just looking at some data. South Africa is currently, I think, number 5 on the all-time list of cases after USA, Brazil, India and Russia, I think it is. So we're right up there. And just a few weeks or months ago, we were at the bottom and we were looking at the top and seeing what's happening in the UK and Italy and Spain and France. And now it's our turn to be there. So it seems to be a so-called normal progression of the virus, that every country must reach its peak, and after that, hopefully things will slow down. And our peak is coming, we're getting there, and hopefully we'll be able to get over that and see the numbers start to drop. Last night was 7,000 cases compared to 12, 13, 14,000 over the last few weeks. So hopefully we're getting there and it can start coming down. Okay, let's start with this. What about the assumption, according to some professors, infectious diseases specialists in our country, what about the assumption that our numbers are actually, right now, probably 10 times more than what they are, which would place us in the region of 4 million. So if we're looking at a peak, realistically, it's probably a lot more. So I don't think I'll be under or overestimating numbers if I talk in the millions. Okay, so that's a challenging one, because there's always going to be logistics involved. Okay. We're always going to have a capacity problem. Do we have the capacity to test? And obviously the more we test, the more cases we'll find. Then at the same time, you're also telling people, look, only test if you have symptoms. Yet we know that there are many, many people who are asymptomatic, and we're finding that out when we send them for an operation, or before they get admitted to hospital, they come out positive. So incidentally, we're finding so many. So in the ideal situation, if we ideally could test everybody, I think we'll then get a true reflection. But as it stands now, we just have to assume. And I think this is my point that I'm coming to. What I believe is, for now, everybody is positive until proven otherwise. And that's the only way we have to look at it in order to protect ourselves and in order for the amount of new infections to decline. It's because we think we know the person, we think we are close to them, we think they're looking after themselves, or they're taking all the right precautions, and so we let them into the home and we let our guard down, and they have no symptoms, and we have a false sense of security. So I think the numbers are much, much more than we currently have, and that's also reflected in this discrepancy between the COVID deaths and the unaccounted for deaths that we've seen in the data that's come to the fore over the last few days. Yeah, so again, it's a capacity problem. Again, it could be a shortage of test kits. And this is also what we see in the spikes. So today may be 7,000, tonight might be 13,000. I don't think it's the fact that there were overnight so many new infections. It's probably that so many results suddenly became available, or more test kits became available. And that comes down to logistics. And unfortunately, that's a problem, because you can imagine if you get sick today and you go for a test and your result comes back in 2 weeks' time that you're positive, and that's the time that they're supposed to be already pronouncing you as recovered. You see? And what if you haven't isolated in that time? What if you haven't been at home? What if you've still been going to work because I'm still waiting on my results? And so all this creates some degree of chaos, in the sense that we have people walking around potentially positive who don't know the results but are not behaving as if they are positive. And so the message really is, under these circumstances, if you are sick enough to be tested, then you are sick enough to go home and isolate until those results come. And if it takes 3 weeks, you stay there until those results come. But the issue of going for a test and because you're waiting, then carrying on with life and you're only going to isolate when the result comes, that's wrong. And that's the fault of healthcare professionals. We should be telling patients, listen, if you earn the right to be tested, you earn the right to go into isolation and stay there until you get your result, or at least until the 10 days of isolation are over. Yeah, so I feel sorry. I love my president and I feel so sorry for him because of the pressure. On the one hand, you have the scientists who look at what the data shows. On the other hand, you have business people or the politicians. And somehow the two must meet and have some compromise. For instance, the church is open. Churches were allowed to open with 50 people. I'm a pastor, but I'm also a doctor. Do I open my church or not? I decided I'm not going to open the church because it was too early. And it was a decision that was driven by pressure and not by science. If you look at what is the highest risk for transmission of HIV, transmission of COVID? Highest. Indoor gatherings, churches, funerals, weddings, nightclubs, indoor bars. So by opening churches prematurely, you are setting, and I can show you in my community, pastors have been buried, elders have been buried, congregants have been buried, all through churches and funerals. So I have not opened my church. The same thing comes with schools. The science tells us that it is safe for children to go to school. Children do get the disease. They get it mild. Most of them are asymptomatic. They do not end up in hospital, and very few ever die from it. They are not the drivers of the epidemic. They do not spread. They are not super spreaders. So they don't get it from teachers. They get it at home. Can you believe it? Parents give it to the kids. Kids then may take it to school and infect one or two other kids, but not the other way around. And they don't bring it home to Opa, Oma, and Granny. Okay? So the fat kids, the well-off kids are getting fat at home. The starving or the poorer kids are not getting the food supply, so they are starving. And where's the safest place to be for a child? Outdoors. So it's a wrong decision, scientifically. But there's pressure. Then the other aspect, there's an aspect of, should children go to school? Yes. Should schools open is a political question or a socio-economic question. Are schools equipped with running water? Do they have facilities to have adequate hand hygiene? Do they have adequate facilities to have proper social distancing, to wear masks every day, to test the kids, to do the symptom screening? You see, so I can easily say boldly, schools must open. But what about the other side? The challenges that so many schools have. And this is the difficulty that I believe our government sits with, trying to satisfy both. But unfortunately, being a medical doctor, I have to go with the science. And if the science tells me schools ought to be open, or there's no problem with schools opening, I must say I believe that schools must open. So, I mean, the same question can be asked about the hospitals. This is why we had the lockdown, to build up capacity. And it's a shame that the pandemic is showing up all these shortcomings and discrepancies. Things that should have been done years ago. Not for a pandemic, but for what schools need and for what communities need and for what children need, is being shown up to be such a shortage, such gaps between different schools and different communities. And it's a shame. It's a shame that schools have to be closed more often than not because of the shortage of basic supplies, the shortage of equipment, the shortage of anything. For me, it's sad because at the end of the day, we are doing harm to our children. The impact of COVID on the mental well-being of children still has to be documented. There's some good evidence already. But we are going to suffer the long-term consequences of keeping our children at home when they should have been at school. And again, I'm not a politician. I can only talk. It's hard for me to put aside that and put on my dad hat or put on my taxpayer hat because I'm so driven by the science. But all I'm saying is this should have been done, guys. This should have been done already. Schools should have been ready and equipped. This pandemic has shown us up embarrassingly short in terms of our healthcare system and infrastructure and in terms of the schools. Well, exactly, because kids are not the drivers of the epidemic. So keeping them at home is not going to do anything to to the peak. The peak's still going to go at a rapid rate because kids are not driving the epidemic. Adults are. And all that we're doing is making things worse, because how does an adult supposed to be at work? Now if the kids are at home, who's going to look after the kids? How does that impact them financially? You see, so it's everything impacts everything else, and we try and kill one fire and another fire springs up somewhere else, and until we are all over the place, and ultimately what happens, the peak just carries on. It just carries on. But this is what coronavirus does. It's going to peak, and there'll be another wave will come, and another wave, until hopefully we get a vaccine. So for me there's two aspects. One is that obviously your own personal health is an issue. You need to look after yourself. And I always say the mainstay is get sufficient amount of sleep, exercise regularly, 30 minutes a day, 5 days of the week, and eat healthy. 5 portions of fruit and veg, drink copious amounts of water, adequate amounts of water. That's your basic. That will help with cancer, prevention of hypertension, diabetes, and everything else, and good for longevity. Exercise is the best vitamin. The problem comes in that this is a novel virus. All of us do not have any immunity to this thing. So it doesn't matter what we're doing, we are all equally at risk. The difference comes in is how bad we are going to get sick. The complications that we can have, whether we're going to land up in hospital, whether we're going to have an asymptomatic, mild, moderately severe infection, landing up in hospital, in ICU, on oxygen, on a ventilator, or dying. That is unpredictable, and that's the thing with COVID. We don't really know. We know that with older folk, it happens. Those with obesity and other comorbid conditions, it happens. So yes, there's an element that we should all be healthy, we should all be living right. But there's no guarantee that will actually protect you against getting the virus. You see? So that's on a personal level. Then the other, for me, what's even more important than that, is that you can be doing all that, but if you're letting the virus in, it's a problem. And this is why I feel so strongly, and I agree 100% with my president, that no family visits are allowed. Because I've had patients, my one patient who's died out of 120 something patients, my one patient who's died, never left home. Okay? What is going on? Patients are looking after themselves, they're staying indoors, but by opening our doors and letting visitors in, we give an opportunity for the virus to come. And so we need to abide by stay home, no visiting, no visitors. That's where you're going to curb it. Right? Your risk by going to the shop is not a bad thing. It's low risk. Okay? But as people whom we know that we allow into our space in a closed environment, and because we know each other, and because we love each other, we're loving families, we let our guard down, we take off our masks, we hug and kiss, and we sit down and we eat. But that person was out without a mask or in a meeting, in a closed space, no ventilation, and then 2 days later gets a phone call, sorry, when we had our meeting, I've just found out that I'm COVID positive. Oh, but I went to visit mom and dad, and I had dinner with them, and I brought them this. It's too late, you've already brought the virus home. You see? So there are certain basics that we must abide, and the time of relying on government to set regulations and rules and levels and all sorts of things is past. We, on an individual level, each of us have to take responsibility for our own health and make sure we prevent the virus from coming in, we don't take it out to anybody, and we protect each other and our families. And that's where it starts. No visiting, stay home, no visiting, and no visitors. This is Dr. Marlin McKay. Thank you so much for having me on onlinemags.co.za.